Let's look at heart blocks really quick. Very easy to differentiate the different heart blocks is, right? There's 3 different degrees. Let's talk about what they are first. It says the term heart block refers to a dissociation between the SA, which is the pacemaker site in the atrium, and the AV junction, right? And then eventually to the ventricles. Understand that there's a random delay that occurs in that AV junction. Now, if you remember what I talked about in the beginning of this boot camp, the AV junction, the whole role of that AV junction is to slow down that rate and allow the ventricles to fill with blood. That's it. If there is a delay in that AV node, that means there's a block, right? There's something blocking that conduction to make its way down into the ventricles. Okay, so let's take a look at them. They're called AV blocks, right? So we got some rules here to look at. It says first degree is not really a true block. All it means that there's a delay, and that delay is located in the AV node. It's a PRI issue, right? So whenever you look at that PRI, remember PRIs are supposed to be no greater than 0.20 seconds. If it's greater than 0.20 seconds, it's considered a block. We'll take a look at them, don't worry. Second degree type 1, also known as Wickenbach, also known as Mobitz 1. All right, there's an intermittent block. Some beats are conducted and others are blocked altogether, which means that there's going to be a missing beat, right? There's going to be a completely gone, vanished QRS complex. It says pathology can be within the AV node or below in the bundle of His. Pathology is often blended with other types of blocks as well. Now there's type 2. Type 2, also known as Mobitz 2, also known as high degree AV blocks, right? Type 2 is also going to have a missing beat. So type 1 and type 2 are both going to have missing beats, which makes it super easy, man. The second that you see a missing QRS complex in your EKG, you instantly know it's a second degree block. You just got to figure out which one is it. And I'm going to show you how easy it is to differentiate the two. Now, the last block is a third or complete heart block. Atrium and ventricles are completely dissociated, so they don't correlate together at all. Now, we looked at so many other EKGs where you see that the P waves precede the QRS complex, and it is that way every single time. In a complete heart block, it does not go by those rules, right? There's a total block going on. Let's look at a first one, first degree block. Remember, we're looking at the PRIs, right? The PRIs are going to be greater than 0.20 seconds, a constant across the strip. Nothing changes. It is basically, it's a normal sinus rhythm with a wide ass PRI for no damn reason. Okay. So we take a look at this one. We know this one says it's 0.24 seconds, right? So it's 6 little blocks instead of 5. And that's, remember, starting at the beginning of that P wave and then all the way to the QRS complex. That's all a first degree block is. Now let's take a look at second degree. Second degree is not that scary, I'm telling you. Now, the first one we're going to look at is type 1, also known as Wickenbach. Whenever you see a drop beat, the first thing I want you to say is what's going on with the PRI? What's going on with my PR interval? And is it changing? Let's take a look at this. So we look here and we see immediately, dude, I see 3 missing beats in this first one. We see a missing beat here. We see a missing beat here. We see a missing beat here. We see that there's a lot of what looks like P waves, right? So let's take a look at this first one here, right in the middle. The PRI here looks normal. Here, it also looks somewhat normal, but it's a little bit delayed. All right, it's actually exactly 5 blocks, which makes it still not totally delayed, but it's different than this first one. So as long as the PRI is changing in length, and then there's a drop beat, we call this second degree type 1. Going, gone. All right, let's take a look at this one down here. we get a P wave here. This one looks normal. Right here, still looks normal, but it's one block or almost one block greater than this one. Over here, it's even more delayed, and then we have a drop beat. Going, gone. Changes in the PRI. There's nothing crazy going on with the QRS complexes, except there's some that are missing, right? They all look completely normal. There's just a change in the PR interval. It's all you need to pay attention to. Let's look at second degree type 2. Second degree type 2, it says the AV node selectively conducts some beats while blocking others. Those that are not blocked are conducted through the ventricles, although they may encounter a slight delay in the node. Once in the ventricles, conduction proceeds normally. Now, you're going to see that there's some different ratios here at the bottom. It says 2-to-1, 3-to-1, 4-to-1. You'll see exactly what I'm talking about. What you need to pay attention to is their drop beats, and is that PRI staying consistent, or is it changing? Remember, if it's changing, it's a second degree type 1. If it's not changing, it's a second degree type 2. So let's take a look. Now this first, and I know this is a weird one to show you guys first, because you're looking at this beat, you're like, dude, I don't see any missing beats. Now take a look at the P waves, right? We see P waves, and right before these QRS complexes, we see a T wave, then what appears to be another P wave. Now you can see how this can be challenging, man. If you're like, is this patient hypokalemic? Is that would we consider that a U wave? All right, or is this a second degree type 2? And the only reason why this is a second degree type 2, remember, is that PRIs are not changing. Right? Let's say that you had this question on a test and they said, hey, what kind of block is this EKG? This would be a second degree type 2, not a complete heart block. Now, I knew, Zach, someone was going to ask, and honestly, I would have no idea. Because remember, all a U wave is just an additional beat after a T wave. So that's kind of what we have, is an additional beat after our T wave. So this can easily be mistaken. And it's funny because whenever you look up hypokalemia and you start looking at, hey man, how can you differentiate hypokalemia? It even says it in the textbook. Often misdiagnosed as a P wave. All right. And if it is consistent and you see it like this can easily be misconstrued as, hey dude, these are U waves. If you had a test question and it said, what kind of block would this be? We know that this is not a complete heart block because they're in order. P wave, QRS, P wave, QRS, P wave, QRS, and they're all in the exact same position, right? Nothing's changing. Right here, there should be a QRS, but it's gone, which makes it a second degree. Let's take a look at another one. So we have more second degrees here with different rates, right? So this one would be a 2-to-1. We have 2 P waves to every 1 QRS complex. Let's take a look at this one. Here's another 2-to-1. We have 2 P waves before every QRS complex. This is the same kind of concept as the last one. Look at this 3-to-1. We have 3 P waves. There should be QRSs in between them. Now remember, we have to pay attention to the PR interval. And are they changing before those QRS complexes? And the answer is no. Look at right before these QRS complexes. Are there any differences? They're all the same, but there's missing beats. That's what makes this a second degree type 2. Check out that 4-to-1. And you want to know what's crazy, man, is so many people will look at this second degree type 2, this one on the top, and call this a complete heart block. They're like, dude, look how many P waves there are to QRS complexes. So for a lot of people, that's like, yeah, that's like almost the definition of a complete heart block. But you have to look at the QRS complexes that are here, that were given. Is there a P wave before it, and do they change? If the answer is no, it's a second degree type 2. That's the rule. All right, here's a variable one. It changes a little bit. Again, the PRIs still stay the same, but we have just a bunch of P waves in between. We have missing QRS complexes. I see there's a question, and T waves. Yep, there are also T waves missing, right? Because then there's just another, there's really no need for a T wave, because you gotta remember, what is a T wave? Ventricular repolarization. If the ventricles are missing, what does that mean? Or the QRS complex is missing, and it means that the ventricles never contracted. So that means there's no need for a T wave, because it's not repolarizing, right? So that's exactly what's happening here. All right, we got second degree type 2. It states, we're good with this. The one thing though that I do want to point out here, because it is down here, it states the atrial rate is usually 60 to 100, which we all know that's the normal intrinsic rate of the sinoatrial node. But it says, since many of the atrial impulses are blocked, the ventricular rate will usually be bradycardic. This is why this is considered a high degree heart block. Understand that. Just because it is a heart block, aka first degree block and second degree type 1, does not mean that you're going to have a bradycardic rhythm. And for that, and I know I said I wasn't going to get into treatment, but because of that, first degree blocks and second degree type 1s are rarely treated, because you don't have to, man. They're not bradycardic. The cardiac output didn't change. What's going to change your cardiac output is if that rate becomes less than 60. All right. And here it states that with second degree type 2, you will get heart rates less than 60. All right. And that's why we have to treat them. We're good with second degree type 2. We just talked about it a bunch. Remember, pay attention to these PRIs. You see how they're always the same? PRI is always the same, but we have these missing beats. Third degree block, last heart block. All right, last heart block that we're going to talk about. Third degree or complete heart block. There's a complete disassociation between the atrium and the ventricles. This doesn't mean that they're not firing. It means that they're firing at their own rates. They're doing their own damn thing, right? We got the atrium going at one rate, we got the ventricles going at its own rate, and they're not correlating at all, okay? It says that the SA is still firing at 60 to 100, but the ventricles are firing at 15 to 40 beats per minute. The block at the AV node is complete. The sinus beats cannot penetrate the node and thus are not conducted through to the ventricles, right? Let's take a look at what that looks like. Now, wherever you see these little arrows, it's showing you where a P wave is located. Now, some of these P waves are actually going to get buried within a QRS complex, and that's completely normal, okay, with third degree blocks. So if you're looking and you're trying to say, well, shit, man, are these P waves really in line? Because I see one's missing over here. It might not be missing. It could just be within a QRS complex. Again, the trick is to grab a sheet of paper, take that sheet of paper over your complete heart block, and with a pen, mark your P waves. And all you need to do with that sheet of paper, once you mark your P waves, is move that sheet of paper from one side to the other, right? And making sure that the P waves line up. And guess what? Your P waves will always be regular with a complete heart block. So as I move my little sheet of paper, because I already marked my P waves, you're going to note that, holy shit, man, all these P waves are lining up. And you can already tell visually by looking at this EKG that my R waves, or my QRS complexes, are also lining up. They're just not talking to the P waves at all. Remember, before each QRS complex, there should be an upright P wave. I see it here in this one, but then right here, it's gone. Just look where it's at. And over here, it's super delayed. And over here, it's all the way over here. Like, they're constantly moving. That makes it a complete block. showing here that the intrinsic rate is up to 40 beats per minute for the ventricular rate. All right, we ready to roll with it? Tell me what block you see. Pay attention to the PRIs. If you said second degree, pretty obvious, right? Because we have a missing beat. We know it's a type 1. Why? Because look at the distance between our P waves to our QRS complex. Right here, it's right before. I know it's probably not the best photo of one, but then right here, you can tell this P wave is now delayed. Then over here, it gets even more delayed. Remember, going, gone. What do we got here? Funky looking beat. I know some of you are trying to scream that there's depression in this. Remember, we're not looking at a 12 lead. What kind of block do you see? It is. Good. First degree block. Because look at the PRI. The PRI is so delayed. And remember, whenever you're checking your PRI, it's the beginning of this P wave. These are funky P waves too, right? You guys see the notches in them? So the front of this P wave to the front of this QRS complex, right? Look how massive, extremely wide. First degree block. What do we got here? Kind of a weird looking beat here. All right, second degree type 1. Why so? Look at this PRI. Look at this PRI. Lengthens, then drops. Lengthens, then drops again. Or this one's even wider and then drops. So this was like a variant type 1. Not good. What do we got here again? It looks like this was going to be a first degree, but then if you look, there's a P wave, or remember, it looks like a U wave after that T wave, and we're missing QRS complexes there. The only way that you would know that this is not a first degree block is if you noticed there's that double upward deflection after the QRS complex. Second degree type 2. This would be a 2-to-1, second degree type 2. So this is a funky looking one. What are you guys gonna call this one? Easy, careful. The only reason why I say that, look here. We have these little funky looking QRS complexes, but look at this PRI compared to this PRI, all right? Now, again, if we take a piece of paper and we mark these P waves, will they correlate together? That's the whole game. The only reason why I wouldn't say this is a second degree block, and some of you are saying that this is a second degree type 2, is the PRIs are changing, right? It's not going, gone, because there's only one QRS complex, right? Look at if all of these were the exact identical PRIs, this would be a second degree type 2. Sure, it would be a 3-to-1, second degree type 2. But because of this QRS complex here at the end, the one at the end is what changed it all. That PRI here at the end is different than these others. That's what makes it irregular. All right, that was a hard one though. I'll give you that. Let's see what we got here. Funky looking beat. Careful, man. Some of you guys jump right on first degree. Look at this beat right here. I don't even know. Are you guys even able to see my cursor? I'm like swinging my cursor all over the place. Look at this beat right here. That's what changes this. Some of you jumped right on third degree block. I'm sorry, on first degree block because you saw these really delayed QR or PRIs. Sure, this is massively delayed. Now remember, if it was a first degree block, first off, the PRIs would be identical all the way through it. So before, if you're taking a test on EKGs, do not jump and say, oh, well, shit, look at this one. It's wide. This is going to be a first degree block. No, look at the next one. This one, there's no delay at all. Then look at this one. This one's massive, way bigger than the last two. Then it gets more narrow. It's all over the place. There's nothing in this EKG that's talking in like a normal pattern other than these QRSs talking to each other, and the P waves, believe it or not, are on cue. All right. The P waves are doing their own thing. The QRSs are doing their own thing. That's what's going on with a third degree block. All right. Next one. Don't worry, we're almost done. We're almost there. Now, this is a funky ass looking EKG. I know for sure some of you guys want to call elevation on this one. All right. Again, these would be the P waves. If I were the one, I'm sorry, let me go in and close this again. If I was the one testing here and I had another sheet of paper that I can use, this is exactly what I would be doing. I would grab that sheet of paper, I'd put it over my test, and I would mark this one right here. I would mark this one right here, and then I would mark this P wave right here. Those three would be the ones I would mark, and I would just slide my paper across this EKG, seeing that those P waves line up with other P waves. Now, again, you look at this PRI, it is delayed for sure, but then look how much more delayed this one is. And then even more delayed this one is. So this shit's all over the place. Here, there's a P wave inside of the QRS complex. So this is just all over the place. I know this EKG looks scarier than it actually is. All right, that's a complete heart block.